Governor of Puerto Rico says the conditions there after Hurricane Maria are, quote, apocalyptic.
The question is, what is a disaster-related death?
And throwing the entire island of 3.5 million people into complete darkness.
Numbers matter.
The official death toll has now risen to 64, although other reports indicate it may be more than 1,000.
When will we learn the entire coast is at risk?
He would be still here today, I think, if it wasn't for Maria.
Every death is a horror, but if you look at a real catastrophe like Katrina,
the way that these issues are politicized, I honestly think that people mean well when they, say hand the president or hand the governor a number and say this is the number of deaths and here's what you can say. This is fewer than Katrina in New Orleans. But then they say it. And that backs them into a corner and it puts them in a position where it's very, very difficult if it turns out to not be true.
Numbers matter, and saying that there were only 64 deaths made it seem as if the impact of the hurricane was insignificant.
Right after the storm, officials relied on death certificates that showed very specific storm-related causes of death, like a tree falling on someone. But researchers suspected the impact of the disaster was much larger. Several independent teams set out to gather data in the following months.
There are other ways to count deaths that are also widely accepted in the scientific literature. One of them is household-based surveys, where you literally go out and knock on people's doors and ask them what happened and who lived and who died and who moved and who came into their house and who left their homes after the hurricane, which is exactly what we did. We essentially looked at all the barrios, which are neighborhoods or a small administrative area. There's 902 of them across the island. And we divided them up based off of remoteness. We then made sure that we sampled an equivalent number of barrios from each of those categories and put down points on buildings randomly in each of these barrios. With all of these points, all the data collectors used a tablet, navigate to a location, see if it's a household, and then survey the individual in that household. We found about 800 to 8,000 excess deaths based on our calculations, the midpoint of which was 4645, the number that you saw in the media.
Harvard's estimate was shocking, and the public was furious that the official death toll remained much lower.
The government of Puerto Rico was quite concerned that they didn't have a solid and accurate number that they could use to say, what was the actual impact in terms of mortality. So they approached us to find out if we would be willing to do that.
Researchers at George Washington University came up with a new number, 2,975. By comparing death records from September 2017 to February 2018 with years past. The study also looked at whether disaster-related deaths had been properly accounted for.
The death certificates in Puerto Rico are done about as accurately as anywhere else in this country, but there isn't enough information about some of the circumstances around the deaths. For example, somebody is dependent on a home oxygen system. They lose power to their homes, and so that doesn't work. If that leads to their death, to me, that is a storm-related death. But there isn't training to put that on the death certificate.
He sent us a video. He said everything was fine. The hurricane's gone. And he didn't really complain about it. That's just the way my father was. And when, if he had a sandwich, he would eat half of the sandwich in the morning and save the other half for the evening, and that's how he got by. 3 weeks after that, he passed away. My father died in the house. That night, he called for an ambulance. The ambulance never arrived. It was a mess out there. There's some roads that you didn't have access to, and I felt that because of his age, they were trying to dismiss it as natural causes, but it wasn't natural causes. Hurricane Maria caused that.
1/3 of the deaths in the households we interviewed were attributed to delayed or interrupted medical care, not having access to the equipment they normally use because of electricity, unable to reach the clinics. They reached a healthcare facility, but the doctor wasn't there. They were not able to activate 911, and so on and so forth. The question is, what is a disaster-related death? Is it just a direct death, or do you count other kinds of deaths? And I think it's extremely important because that is how people now die from disasters. The disruption of this interdependent, codependent infrastructure that we have built in our lives and our societies makes our populations very vulnerable.
One of the most important things that I think that we can do is to understand the specific causes of death and which of those are preventable for future disasters.
We're finding increasingly so, both in the developed world and in the developing world, that there is a prolonged tail to these disasters where deaths are then attributed to interrupted medical care. I think Sandy was a wake-up call where we realized when downtown Manhattan lost electricity, people started showing up in the emergency departments requesting that their medicines be refrigerated, or showing up in the ER for dialysis because dialysis centers had been closed. We're going to see a rise in the chronicity of diseases that people suffer from, and the dependence on electricity and infrastructure, including cell phones and apps, and who knows what the future holds, that we need to account into our disaster planning.
If you lose power, you're going to risk loss of life. We saw that in Florida with the recent storms. We saw that in Beaumont, Texas with Hurricane Harvey. We saw that in New Orleans with Katrina. When will we learn the entire coast is at risk and that medical care facilities, health care on all the coasts, including the islands, needs to be much more resistant to damage from these storms, or the people who are the most vulnerable will be at risk.